Going into a major surgery can be a very stressful life event, but here's what you can do to be as organized and prepared for anything that may come at you. I just found out a couple days ago that I need to go back in for a full open heart valve replacement surgery. This is the saw open, split the case, the whole works. Now, I went through this surgery about 13 years ago, so I have a data point. I know a little bit about what to expect. Now, most of you won't have this advantage. If you do, great. If not, step one that I would recommend is do some research on it. Look at your surgery, figure out some basics around it and what to expect. Now, you want to look at several items. One of the first ones is the risk. Now, the procedure itself will have inherent risk as a normal, right? But then you also want to look at any specifics around your condition. How is your overall health? Have you had problems with this body part before that may add complication to it or higher risk? Another is the recovery. What kind of medications will you be on? What kind of constraints will you have as far as lifting or driving and exercise activities, any other kind of limitations, and for how long should you expect? And just any other special considerations around this type of surgery that you should be aware of. Now, that's just a little bit of education, which is going to be handy for you. The second step is really the most important. Your number one goal for all this, top priority, is survival. Everything you do from this point forward should be focused on surviving the surgery and a safe, quick recovery to get back to the most healthy, happy state that you can as soon as possible. For me and my bum heart, that means being as healthy from a cardiovascular standpoint as I can with what limits I have. So that means things like, I'm lifting every day, I'm swimming every other day, I'm trying to get as healthy as I can and have that heart as strong and healthy and able to make it through that surgery. The other thing is that my breathing is highly affected by my health habits. So in addition to the exercise I mentioned, I'm also eating very disciplined, trying to cut whatever excess weight I can, not drinking, getting a solid night's sleep. Now, because my procedure is going to be on the heart, it's also very important for me to be as relaxed and de-stressed as possible, which we all realize is a little bit tough when you're looking at a major surgery. So I'm trying to do everything I can to just stay relaxed, take care of things, worry about as little as possible. The best thing is just to be prepared for any outcome imaginable. And that means understanding the basics, research what you need to, accept what you know, and don't worry about what you can't control. Now, that brings us to the next step, getting organized. A lot of this step is going to depend on your estimated risk of survival. Now, you don't want to be all doom and gloom before the procedure, but you also don't want to go into it blindly optimistic. You want to be realistic and objective about the risk of the procedure and your personal risk with your personal health condition. Now, one of the basic things that we all should do, even if we don't have a big surgery looking at us, is have a basic will written up. You can go through an attorney, there are legal websites you can go through, but you should have those basic things laid out in a will, things like advance directives. Make sure you list beneficiaries on your retirement fund or your life insurance policies. If you're like me and you've ever dealt with the loss of somebody close to you, you understand that at that time, it's hard enough as it is, and the last thing you want to do is create more headaches for your loved ones left behind with logistics and legal nightmares trying to figure it out, because it's never easy and it comes at the worst time. Another thing along those lines is just organize your life, your house. It's a good time to go through these rooms and organize your documents or throw away that old junk that you don't need anymore. Go through your clothes, whatever it may be, but just think about someone having to walk in after you if things don't go well and having to empty that house, and just make it as easy as you can for them. Be considerate. The next step is to consider your recovery. Now, we talked a little bit earlier about some constraints that may be put on you as you get out of surgery. You may be on medication for a while that's going to jack with your mind. You may have limitations as far as you can't drive and go places, or maybe you can't lift more than 5 or 10 pounds. And if you think about it, 5 or 10 pound limit, that's pretty significant. That means you can't let your trash get too full. You can't go get groceries. So you want to think about things like, how are you going to eat? Do you have enough food stored up in the house to last you during your constrained recovery? Or do you need to make sure that there are delivery services, whether it's meals or groceries, and how do you get them around throughout the house? Honestly, I've got a skateboard that I'll probably have easy access to so that if I do need to roll something around the house, I can use a skateboard or a cart or anything else. Things like dog food. If you have an animal, I'm not going to be able to lift this massive bag of dog food and dump it into his container, so I want to refill that in advance and have that done as well. Any kind of heavy lifting items or awkward tasks, make sure that they're done prior to your surgery. The next thing you want to think about is what makes you happy. Once you're on a solid path to being healthy and making your best chances of survival and recovery, then you're organized. You also want to think about just happiness with the time you have, right? And ideally, it's just a bump in the road and you're going to be fine afterwards, but you have to be realistic about your risk. For me, I know that valve replacement surgery is not uncommon. It gets done every day and most of them go perfectly fine. I also know that in my case, the last time I had it, I had almost every complication you can imagine. I was in the hospital for 17 days instead of 5, and my recovery was pretty miserable. So I also know that I'm 13 years older now, and my heart's not only been through the 2 surgeries I had back then, but I also had a hole closure and a couple ablations a couple years ago. And I know that my heart is just, it's getting worn out. It's getting scar tissue. So I know that I carry a higher risk than a first-time valve replacement patient. So I need to be realistic about what are the chances. Now, most likely, yes, I'll come out the other side and it'll be painful, but I'll be fine. But you just want to think about things like risk, and if this were the end, would I be happy with what I did? And so this is a good time for reflection and being able to say that I lived life the way I wanted. I did everything I wanted. Now, if you know that you're going to survive the surgery, which nobody knows 100%, but if you know you're going to continue saving for retirement like you always would, but if you knew that this was it and you weren't probably going to survive the surgery, what would you do differently? Would you sit there with all that money in the retirement account and be okay with that? Maybe you are because you want to leave it to your kids or whatever. But if you don't, is that the time to consider pulling some out? And some people would say that's silly to do. And I'm not telling people to go out and buy the Ferrari, but I'd be lying if I said I wasn't thinking about it myself. And you start to realize as you think through these things and you get closer to that surgery, you start asking yourself, if I only had 3 weeks left on this earth, is this what I'd be eating? And that's a tough one because you want to eat foods you enjoy, but you also want to stay healthy. So you have to find that balance. You might ask yourself, is this really where I'd be spending my money? Or is this, most importantly, really where I'd be spending my time? Your time has become your most valuable resource. It really is for all of us. In fact, then you begin to start realizing, why did it take me this long to ask this question? It doesn't matter if you have a big surgery coming or not. We should always be asking ourselves, if my life is limited, is this really how I want to be spending it? Personally, I don't even like the idea of dying with so much as a quarter in the bank, because that means that's a gumball I could have enjoyed while I was still alive. But we all have to look at our own risk, our own health, our own priorities, and make that decision on where that balance is for us. Depending on your situation, your time could be limited depending on the risk. So spend the time the way you want to. Spend it with your family, your friends, your pets, by yourself on a beach with your feet in the water, whatever you want to do. There's nothing wrong with wanting some alone time because it's a lot to absorb. It's a lot to get your head wrapped around, and you want to be at peace with whatever happens, de-stressed, calm going into whatever it is. That's going to better your chances. I wish you all the best in your procedure. Get healthy for it. Be prepared and organized, calm. Come out of the procedure, have a great recovery, and appreciate every day you get.
Subscribe to my YouTube channel below and let's celebrate turning fuel and air into adrenaline.